Brad Williams, Frugal Finance, top Medicare Part D providers for 2025. This is not an endorsement by Frugal Finance. This information is provided by a non-named third-party source. Medicare Part D is a government program designed to assist people with original Medicare Parts A and B in managing prescription drug costs. This program is offered by private insurance companies approved by Medicare, with coverage varying by state. If you're looking to find the best Medicare Part D plans for 2025, this information was evaluated based on factors such as customer satisfaction, affordability, star ratings, and drug costs. Below are some of the top providers to consider. The leading Medicare Part D providers: Aetna, best overall, and for customer satisfaction. Aetna consistently ranks as the top choice for Medicare Part D plans. With impressive star ratings from Center for Medicare and Medicaid Services and reasonable premiums, Aetna stands out for its quality service and overall value. WellCare, best for low premiums. For those on a tight budget, WellCare offers the most affordable premiums among the providers we reviewed, making it an excellent option for cost-conscientious individuals. United Healthcare, best for out-of-pocket costs. United Healthcare, offered through ARP, provides some of the best out-of-pocket pricing, which can be especially helpful for those with multiple prescriptions or higher medication costs. Cigna, competitive pricing. Cigna delivers competitive pricing across both premiums and out-of-pocket expenses, making it a solid choice for individuals seeking a well-rounded Part D plan. How to choose the right Medicare Part D plan? Selecting the ideal Part D plan depends on several factors, including the specific medications you take, your preferred pharmacy, and your overall budget. Here are a few tips for making an informed decision. List your medications. Write down the names and dosage of the medications you take. This helps ensure that the plan you choose will cover them. Check the plan's formulary. Part D plans have a list of covered medications called a formulary. Be sure to check your medications are included. Note any rules like prior authorization requirements. Compare costs. Look at monthly premiums, deductibles, and copays. A lower premium may seem attractive, but it could result in higher out-of-pocket costs if you take multiple or expensive medications. Pharmacy network. Verify that your preferred pharmacy is in the plan's network. Out-of-network pharmacies may result in higher prescription costs. Review star ratings. The CMS assigns star ratings to plans based on their performance and quality. Plans with higher ratings generally offer better customer satisfaction. What's new for Medicare Part D in 2025? Starting in 2025, there are a couple of notable changes to Medicare Part D. Out-of-pocket spending limit. A new yearly cap of $2,000 will apply to out-of-pocket drug costs, making it easier for people to manage their medication expenses. After reaching the limit, you won't pay for covered drugs for the rest of the year. Prescription payment plan. This program allows those enrolled in a standalone Part D plan or a Medicare Advantage plan to spread out their prescription drug payments throughout the year rather than paying the full amount at once. Key information on Medicare Part D costs. The cost of Medicare Part D plans vary based on factors like the provider, location, and the medications you take. Here's a breakdown of the typical costs involved. Monthly premiums. These generally range from $0 to $100 or more. In 2025, the average premium is projected to be $40. The premiums vary based on the plan and the level of coverage. Annual deductible. Medicare Part D plans have a deductible, which is the amount you must pay before the plan begins covering your medications. For 2025, this deductible can't exceed $590. Copay coinsurance. These are the out-of-pocket costs for each prescription. Depending on the drug, you may pay a flat fee or a percentage of the drug costs. Enrollment and deadlines. Medicare Part D enrollment happens during specific periods. The annual enrollment period runs from October 15th to December 7th each year, during which you can review, change, or drop your plan. If you're new to Medicare, you can enroll during your initial eligibility period, which spans 7 months, starting 3 months before you turn 65. If you don't enroll when first eligible, you may incur a late enrollment penalty, which increases your premium. How we evaluated Medicare Part D providers? To evaluate the top providers for 2025, this information was reviewed from market intelligence sources like the Kaiser Family Foundation, Stardust Group, and McKinsey. Additional information considered quality ratings from agencies like AM Best and NCQA, and used data from the Center for Medicare and Medicaid Services. Each provider was rated based on several factors, including star ratings, cost, and availability. These factors helped us identify which Medicare Part D providers offer the best value in terms of cost, quality, and customer satisfaction. Conclusion, choosing the right Medicare Part D provider for 2025 involves considering your medication needs, budget, and preferences for customer service. Whether you prioritize low premiums, out-of-pocket cost, or overall satisfaction, there are several quality options to meet your needs. Be sure to review your options before the open enrollment period begins in October 2025 to ensure you make the best choice for your healthcare needs. Again, Frugal Finance, Brad Williams, had no input as to this overall evaluation. This is from a third-party source. Comment if you have any questions as it relates to Medicare Part D providers. I strongly recommend you do your own due diligence. I have a whole list of videos pertaining to Medicare, Medigap, and the different policies and the procedures as it relates to Medicare. Check it out. Comment if you have any questions. Brad Williams, Frugal Finance. Thanks for watching. Hope that helps. See you soon.